Hey everyone, Shahab Junaid here, and welcome back to the channel. Today, we're tackling a really common and often unsettling sensation: dizziness. That feeling of unsteadiness, lightheadedness, or like the room is spinning can be incredibly disruptive to your day. You might feel woozy, like you're about to faint, or just generally off-kilter. It's one of those symptoms that can make you pause and wonder, what's going on with my body? And you're right to question it. Because while sometimes it's a minor blip, other times it can be a signal that something more significant needs attention. Dizziness is a general term used to describe a range of sensations like feeling faint, unsteady, woozy, or lightheaded. It can result from various causes, some minor and some more serious. Think of it as an umbrella term. Underneath that umbrella, there are many specific reasons why you might be experiencing this. It's not a disease in itself, but rather a symptom. Our goal today is to explore some of the most common culprits behind that dizzy feeling, from simple everyday issues to more complex medical conditions. We want to empower you with knowledge so you can better understand what your body might be trying to tell you. We're going to break down 8 common reasons why you might be feeling dizzy, discuss what's happening physiologically, and most importantly, talk about what you can do about it. Knowledge is power, especially when it comes to your health. By understanding the potential causes, you'll be better equipped to identify triggers, make lifestyle adjustments, or know when it's crucial to seek medical advice. So grab a seat, carefully if you're feeling a bit wobbly, and let's dive into the world of dizziness and figure out how to get you feeling steady and clear-headed again. All right, let's start with 2 of the most frequent and often easily fixable reasons for feeling dizzy: dehydration and low blood sugar. Think of your body as a finely tuned machine. If it doesn't have enough fuel or fluids, it's going to start sputtering, and dizziness is a classic warning light. When you're dehydrated, your blood volume can decrease. Less blood volume means your blood pressure might drop, and this can lead to insufficient blood flow to your brain. When your brain isn't getting the oxygen and nutrients it needs delivered by that blood, you can start to feel lightheaded, weak, and, you guessed it, dizzy. This is especially common in hot weather when you're sweating more or after intense exercise. Many of us are walking around mildly dehydrated without even realizing it. We get busy, we forget to drink water, or we opt for sugary drinks that can actually dehydrate us further. The color of your urine is a good, albeit not perfect, indicator. If it's consistently dark yellow, you likely need to up your fluid intake. It's not just about water though. Electrolytes like sodium and potassium, which are lost through sweat, also play a crucial role in maintaining fluid balance and nerve function. So, if you're sweating a lot, an electrolyte drink might be more beneficial than plain water alone to replenish those lost minerals and help your body rehydrate more effectively. Now let's talk about low blood sugar or hyperglycemia. Your brain relies heavily on glucose, sugar, for energy. If your blood sugar levels dip too low, your brain is essentially running on empty. This can happen if you skip meals, if you're on certain medications for diabetes, or even after very strenuous exercise if you haven't refueled properly. That sudden wooziness, perhaps accompanied by shakiness, sweating, or confusion, could very well be your body screaming for sugar. It's a direct consequence of your brain cells not having enough fuel to function optimally. Think about those times you've been so engrossed in work or a project that you've completely forgotten to eat. Suddenly, you stand up and feel that wave of lightheadedness. That's often low blood sugar talking. Maintaining stable blood sugar levels is key. This means eating regular, balanced meals and snacks. Don't go for long stretches without food, especially if you know you're prone to these dips. If you do feel the symptoms of low blood sugar coming on, having a small, quick-acting source of sugar like a piece of fruit or some juice can make a world of difference in the short term. The connection between these two is quite strong. Sometimes if you're dehydrated, it can also affect how your body regulates blood sugar. And if your blood sugar is low, you might not feel like drinking, potentially leading to dehydration. It's a bit of a cycle. The key takeaway here is consistent hydration throughout the day, not just when you feel thirsty, and consistent, balanced nutrition to keep those energy levels stable. Small sips of water frequently are better than chugging a huge amount at once. So what's the fix? For dehydration, it's pretty straightforward. Drink more fluids, primarily water. Aim for at least 8 glasses a day and more if you're active or it's hot. Carry a water bottle with you as a visual reminder. For low blood sugar, ensure you're eating regular meals that include complex carbohydrates, protein, and healthy fats to provide sustained energy. don't skip breakfast. If you're an athlete, pay close attention to your pre- and post-workout nutrition and hydration. These simple habits can significantly reduce episodes of dizziness for many people. Remember, these are often the first things a doctor will ask about if you complain of dizziness. Are you drinking enough? When was the last time you ate? Because often the solution is right there in your daily routine. Before we move on to more complex causes, really take a moment to assess your own habits in these areas. Sometimes the simplest explanation is the right one, and making small adjustments here can make a huge impact on how you feel day to day, keeping those dizzy spells at bay. Now let's journey into a more complex area, the inner ear. Your inner ear isn't just for hearing, it's a crucial part of your vestibular system, which is essentially your body's balance center. It's like an incredibly sophisticated internal gyroscope, constantly telling your brain where your head is in space, whether you're upright, tilted, or moving. When something goes wrong with this intricate system, the signals to your brain can get scrambled, leading to a very specific type of dizziness called vertigo. Vertigo is often described as a sensation that you or your surroundings are spinning or moving, even when you're perfectly still. One common condition affecting the inner ear is benign paroxysmal positional vertigo, or BPPV. This mouthful of a name describes a condition where tiny calcium crystals, called otoconia, which are normally embedded in one part of your inner ear, become dislodged and float into the semicircular canals. These canals are sensitive to head movement, so when these crystals are in the wrong place, certain head movements like rolling over in bed, looking up or bending down can trigger intense, though usually brief, episodes of spinning. It's like a rogue piece of gravel got into the delicate machinery of your balance system. Then there's labyrinthitis or vestibular neuritis. These conditions typically involve inflammation of the inner ear or the vestibular nerve, the nerve that connects the inner ear to the brain, often following a viral infection like a cold or flu. This inflammation disrupts the transmission of sensory information from the ear to the brain. The result? Sudden severe vertigo, often accompanied by nausea, vomiting, and difficulty with balance that can last for days or even weeks. It can be quite debilitating, making even simple tasks feel impossible because the world just won't stop spinning. Meniere's disease is another inner ear disorder that can cause significant dizziness. This is a chronic condition characterized by a buildup of fluid in the inner ear. People with Meniere's typically experience recurrent episodes of vertigo, along with other symptoms like fluctuating hearing loss, tinnitus, ringing in the ear, and a feeling of fullness or pressure in the affected ear. These attacks can be unpredictable and vary in intensity and duration, making it a particularly challenging condition to live with. The exact cause isn't fully understood, but it's thought to involve a combination of genetic and environmental factors. The type of dizziness experienced with inner ear problems is often distinct. It's less of a lightheadedness and more of a true rotational or spinning sensation. You might feel like you're on a merry-go-round that you can't get off, or that the room itself is tilting and swaying. These sensations can be incredibly disorienting and often lead to secondary symptoms like nausea because of the mismatch between what your inner ear is telling your brain and what your eyes are seeing. Your brain gets confused by these conflicting signals. Diagnosing inner ear problems often involves a thorough medical history, a physical examination, including specific maneuvers to check for BPPV, like the Dix-Hall Pike test, and sometimes hearing tests or imaging. Treatment varies depending on the specific condition. For BPPV, specific head maneuvers like the Epley maneuver can often reposition the crystals and provide immediate relief. For labyrinthitis, medications to reduce inflammation and manage nausea might be prescribed, along with vestibular rehabilitation exercises to help your brain adapt. Managing Meniere's disease can be more complex, often involving dietary changes like a low-salt diet, medications to reduce fluid buildup or control vertigo, and in some cases more invasive procedures. The key is getting an accurate diagnosis, because the treatment for one type of inner ear-related dizziness might not work or could even worsen another. If you're experiencing true spinning vertigo, especially if it's recurrent or accompanied by hearing changes, it's really important to see a healthcare professional to get to the bottom of it. Let's talk about blood pressure. We often hear about the dangers of high blood pressure or hypertension, but low blood pressure, known as hypertension, can also cause its own set of problems, with dizziness being a prime symptom. Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps it around your body. If this pressure is too low, your brain and other vital organs might not get enough oxygen-rich blood, leading to that familiar lightheaded or dizzy feeling, especially when you change positions quickly. A very common type of hypertension that causes dizziness is orthostatic hypertension, also sometimes called postural hypertension. This refers to a sudden drop in blood pressure that occurs when you stand up from a sitting or lying position. When you stand up, gravity pulls blood down into your legs and lower body. Normally, your body has quick reflexes. Your blood vessels constrict and your heart rate increases slightly to counteract this and ensure enough blood still gets to your brain. In orthostatic hypertension, this response is delayed or insufficient. The result? For a few seconds or sometimes longer, your brain experiences a temporary shortage of blood flow, leading to dizziness, lightheadedness, blurred vision, weakness, and in some cases even fainting. You might have experienced this yourself. You hop out of bed in the morning or stand up quickly from your desk, and suddenly the room feels a bit swimmy. For most people, it's a fleeting sensation, but for others, it can be more persistent and problematic, increasing the risk of falls, especially in older adults. Several factors can contribute to orthostatic hypertension. Dehydration, which we've already discussed, is a big one as it reduces blood volume. Certain medications, particularly those for high blood pressure, ironically, antidepressants and some medications for Parkinson's disease, can also predispose you to it. Prolonged bed rest, pregnancy, and certain underlying medical conditions like heart problems, endocrine disorders like adrenal insufficiency, and neurological conditions can also impair the body's ability to regulate blood pressure effectively upon standing. It's not just about standing up, though. Some people experience postprandial hypertension, which is a drop in blood pressure after eating a large meal. This happens because your digestive system requires a significant amount of blood to process food, diverting it from other parts of your body, including the brain. This is more common in older adults and those with autonomic nervous system dysfunction, like people with Parkinson's disease or diabetes. The dizziness usually occurs within 1 to 2 hours after eating. Managing dizziness due to low blood pressure often involves a multi-pronged approach. Firstly, if medications are suspected, your doctor might adjust the dosage or switch you to a different medication. Lifestyle modifications are also key. Drinking plenty of fluids to maintain blood volume is crucial. Adding a little more salt to your diet might be recommended by your doctor in some cases, as salt helps retain water, but this should only be done under medical guidance, especially if you have other health conditions. Other practical tips include standing up slowly and in stages. For example, sit on the edge of the bed for a minute before fully standing. Avoid prolonged standing still, and if you need to stand for a while, try tensing your leg muscles or shifting your weight to help pump blood back up towards your heart. Wearing compression stockings can also be beneficial for some people as they help prevent blood from pooling in the legs. If postprandial hypertension is an issue, eating smaller, more frequent meals, lower in easily digested carbohydrates might help. And always be cautious to avoid falls if you know you're prone to this. We just touched on how some medications can contribute to low blood pressure, but it's worth dedicating a whole chapter to this because medications are a very common, yet sometimes overlooked, cause of dizziness. Many drugs across various classes list dizziness or lightheadedness as a potential side effect. It's one of those things you might see in the fine print of a medication leaflet and not pay much attention to until you experience it yourself. The mechanisms by which medications cause dizziness can vary widely. As we discussed, medications used to treat high blood pressure or antihypertensives are prime candidates. These include diuretics, beta blockers, ACE inhibitors, and calcium channel blockers. Their job is to lower blood pressure, but sometimes they can lower it too much or cause a more pronounced drop when changing positions, leading to orthostatic hypertension and dizziness. It's a delicate balance, and finding the right medication and dosage can sometimes take a bit of trial and error under your doctor's supervision. Sedatives and tranquilizers, such as benzodiazepines, often prescribed for anxiety or insomnia, can also cause dizziness. These medications work by slowing down brain activity, While this can be calming, it can also lead to drowsiness, unsteadiness, and a feeling of being out of it or dizzy. Similarly, some antidepressants, particularly older types like tricyclic antidepressants, can have side effects that include dizziness, often due to their impact on blood pressure regulation or their sedative properties. Even some newer antidepressants can cause initial dizziness as your body adjusts. Certain antibiotics, particularly aminoglycosides, can be ototoxic, meaning they can damage the inner ear's sensory cells responsible for hearing and balance. This damage can lead to vertigo and long-term balance problems. While these are powerful and sometimes life-saving drugs, their potential for ototoxicity means they're typically used cautiously, especially for prolonged periods or in individuals with pre-existing kidney issues, as the kidneys help clear these drugs from the body. Pain medications, especially strong opioid painkillers, are also well known for causing dizziness and drowsiness. It's not just prescription medications either. Some over-the-counter drugs can also be culprits. For example, certain antihistamines, especially older first-generation ones, often found in cold and allergy remedies or sleep aids, have sedative effects that can lead to drowsiness and dizziness. Even some muscle relaxants can have this effect. The key is that any substance that affects your central nervous system, your cardiovascular system, or your inner ear has the potential to make you feel dizzy. If you start a new medication and begin experiencing dizziness, it's really important not to just stop taking it abruptly, especially if it's for a serious condition. The first step should always be to consult with your doctor or pharmacist. They can help determine if the dizziness is indeed related to the medication or if there might be another cause. They might be able to adjust the dose, switch you to an alternative medication with fewer side effects, or suggest strategies to manage the dizziness, like taking the medication at a different time of day, for example, at bedtime if it causes drowsiness. Always keep an updated list of all your medications, including over-the-counter drugs and supplements, and share this with your healthcare providers. Sometimes interactions between different medications can also lead to dizziness. Your doctor or pharmacist can review your full medication regimen to check for potential interactions or cumulative side effects. Never assume a new symptom like dizziness is just something you have to live with, especially if it coincides with a change in your medication. Open communication with your healthcare team is absolutely vital. Next up, let's explore a condition that often presents with fatigue and weakness, but can also be a significant cause of dizziness and lightheadedness: anemia. Anemia isn't a single disease, but rather a condition characterized by a deficiency in the number or quality of red blood cells, or a lack of hemoglobin. Hemoglobin is the protein in red blood cells that binds to oxygen and carries it from your lungs to the rest of your body, including your brain. If you don't have enough healthy red blood cells or hemoglobin, your body's tissues simply don't get enough oxygen. The most common type of anemia is iron deficiency anemia. Iron is a crucial component of hemoglobin. Without enough iron, your body can't produce enough hemoglobin to make healthy red blood cells. This can happen due to insufficient iron intake in your diet, poor absorption of iron due to conditions like celiac disease, or after certain types of gastric surgery or blood loss. Chronic blood loss, even if it's slow and not obvious, like from heavy menstrual periods, or slow bleeding in the gastrointestinal tract from ulcers or polyps, is a very common cause of iron deficiency. When your brain isn't receiving an adequate supply of oxygen due to anemia, you can experience a range of symptoms. Dizziness and lightheadedness are classic signs, especially when you exert yourself or stand up quickly. You might also feel unusually tired or weak, experience shortness of breath, have pale skin, cold hands and feet, headaches, or even chest pain. Some people with severe iron deficiency develop unusual cravings for non-food items like ice or dirt, a condition known as pica. It's important to understand that the dizziness from anemia is typically more of a generalized lightheadedness or feeling like you might faint rather than the spinning sensation of vertigo. It's because the brain itself isn't getting the fuel it needs to function optimally. Think of it like an engine trying to run on a very lean fuel mixture. It's going to sputter and struggle. Your heart might also try to compensate by beating faster to try and deliver more oxygen, which can sometimes lead to palpitations. Other types of anemia besides iron deficiency can also cause dizziness. For example, vitamin deficiency anemia caused by low levels of vitamin B12 or folate can affect red blood cell production, Anemia can also be a symptom of chronic diseases like kidney disease or inflammatory conditions, or result from inherited conditions like sickle cell anemia or thalassemia. The underlying cause of the anemia needs to be identified to ensure appropriate treatment. Diagnosing anemia usually starts with a simple blood test called a complete blood count, or CBC, which measures the levels of red blood cells, white blood cells, platelets, and hemoglobin. If anemia is detected, further tests may be needed to determine the specific type and underlying cause, such as tests for iron levels, vitamin B12 or folate. Once the cause is identified, treatment can be targeted. For iron deficiency anemia, this often involves iron supplements and dietary changes to include more iron-rich foods like red meat, poultry, fish, beans, lentils, and fortified cereals. If you're experiencing persistent dizziness along with fatigue, pallor, or shortness of breath, it's definitely worth getting checked for anemia. It's a treatable condition, and addressing it can make a huge difference, not only to your dizziness but also to your overall energy levels and quality of life. Don't just assume you're tired because you're busy. There might be an underlying physiological reason that needs attention. Treating the anemia will help restore adequate oxygen delivery to your brain, alleviating that lightheaded, dizzy feeling. Now let's shift gears and talk about a cause of dizziness that originates not in the ears or the blood, but in the mind, anxiety and panic attacks. It might seem surprising to some that psychological states can manifest such physical symptoms, but the mind-body connection is incredibly powerful. Dizziness is actually a very common symptom reported by people who suffer from anxiety disorders or experience panic attacks. It's often described as a sense of lightheadedness, unsteadiness, or a surreal, floaty feeling rather than true spinning vertigo. During periods of high anxiety or a panic attack, your body's fight or flight response is activated. This triggers a cascade of physiological changes, and your heart rate might increase, you might start to sweat, and your breathing pattern can change. One common change is hyperventilation, breathing too quickly or too deeply. When you hyperventilate, you exhale too much carbon dioxide. This lowers the carbon dioxide levels in your blood, which can cause blood vessels in the brain to constrict slightly, reducing blood flow and leading to dizziness or lightheadedness. It's a bit of a vicious cycle. You feel anxious, you start to hyperventilate, often without realizing it. You feel dizzy, and then the dizziness itself can make you feel even more anxious or panicky, fearing that something is seriously wrong, like you're having a stroke or a heart attack. This can then worsen the hyperventilation and the dizziness. It's a feedback loop that can be hard to break once it starts. The sensations can be very intense and frightening. Beyond hyperventilation, chronic stress and anxiety can also lead to muscle tension, particularly in the neck and shoulders. This tension can sometimes affect blood flow or irritate nerves, contributing to a sense of unsteadiness or a tension-type headache that has a dizzy component. Also, when you're constantly anxious, your senses can be on high alert, making you more aware of and perhaps more sensitive to normal bodily sensations, including slight feelings of imbalance that you might otherwise ignore. The type of dizziness associated with anxiety is often persistent or comes in waves, particularly during stressful situations or when anticipating an anxious event. It might be accompanied by other classic anxiety symptoms like a racing heart, chest tightness, trembling, nausea, or a feeling of impending doom. Sometimes the dizziness itself becomes a major focus of the anxiety, leading to a fear of dizziness, dynophobia, and avoidance of situations where dizziness might occur or be embarrassing. If you suspect your dizziness might be linked to anxiety, it's important to discuss this with a healthcare professional. They can help rule out other potential medical causes of your dizziness first. If anxiety is identified as the primary driver, then treatments targeted at managing anxiety can be very effective in reducing or eliminating the dizziness. This might include cognitive behavioral therapy, CBT, which helps you identify and change negative thought patterns and behaviors that contribute to anxiety and panic. Relaxation techniques such as deep breathing exercises, specifically learning to slow down your breathing to counteract hyperventilation, mindfulness meditation, and progressive muscle relaxation can also be incredibly helpful. In some cases, medication for anxiety might be considered. Understanding that the dizziness is a physiological response to anxiety and not necessarily a sign of a dangerous physical illness can itself be very reassuring and help to break that cycle of fear and worsening symptoms. It's about retraining your body's response to stress. Our heart is the engine of our circulatory system, tirelessly pumping oxygenated blood to every part of our body, including our brain. If the heart isn't functioning optimally, blood flow to the brain can be compromised, and dizziness can be a key warning sign. This is a category of causes that we need to take very seriously, as heart conditions can range from manageable to life-threatening. The dizziness experienced might be lightheadedness, a feeling of impending faintness, pre-syncope, or even syncope fainting. One major way heart conditions can cause dizziness is through arrhythmias, which are irregular heartbeats. Your heart might beat too fast, tachycardia, too slow, bradycardia, or irregularly, like in atrial fibrillation. When the heart beats too quickly, it may not have enough time to fill properly between beats, so it pumps less blood with each contraction. If it beats too slowly, it's not pumping blood frequently enough. In either case, or if the rhythm is chaotic, the overall output of blood from the heart can decrease, leading to insufficient blood flow to the brain, and thus dizziness. For example, conditions like supraventricular tachycardia, SVT, or ventricular tachycardia, VT, can cause sudden episodes of rapid heartbeat accompanied by dizziness, palpitations, shortness of breath, and chest discomfort. On the other end of the spectrum, sick sinus syndrome or heart block can cause the heart to beat very slowly, leading to fatigue, lightheadedness, and fainting spells. Atrial fibrillation, a common irregular and often rapid heart rhythm, can also lead to dizziness and increases the risk of stroke. Structural heart problems can also be a culprit. Conditions like heart valve disease, for example aortic stenosis, where the aortic valve narrows, restricting blood flow from the heart, or cardiomyopathy, diseases of the heart muscle that weaken its pumping ability, can reduce the heart's efficiency. If the heart muscle is weak or a valve is too tight, it struggles to pump enough blood forward, especially during exertion. This reduced cardiac output means less blood reaches the brain, causing dizziness or exercise-induced lightheadedness. Heart failure, a chronic condition where the heart can't pump blood as well as it should, is another significant cause. As heart function declines, the body tries to compensate, but eventually, blood flow to vital organs, including the brain, can be chronically reduced. Dizziness, fatigue, and shortness of breath are common symptoms in people with heart failure. It's a progressive condition that requires careful medical management to improve symptoms and quality of life. Sometimes dizziness can be a symptom of a more acute and serious heart event, like a heart attack, myocardial infarction. While chest pain is the classic symptom, a heart attack can also present with dizziness, nausea, sweating, shortness of breath, and pain radiating to the arm or jaw, particularly in women or older adults. If dizziness is sudden, severe, and accompanied by any of these other symptoms, it's a medical emergency and you should seek immediate help. Diagnosing heart-related dizziness often involves an electrocardiogram, ECG or EKG, to check the heart's electrical activity, an echocardiogram, an ultrasound of the heart, to look at its structure and function, and sometimes longer-term heart rhythm monitoring, like a Holter monitor or event recorder. Treatment will depend entirely on the underlying heart condition and could range from medications to control rhythm, blood pressure, or improve heart function, to lifestyle changes, to procedures like cardiac ablation, pacemaker implantation, or valve surgery. If you experience dizziness along with palpitations, chest pain, shortness of breath, or fainting, don't delay in seeking medical evaluation. Finally, while it's important not to jump to worst-case scenarios, we do need to discuss that in some instances, dizziness can be a symptom of a serious underlying neurological condition. These are generally less common causes of dizziness compared to, say, dehydration or inner ear issues, but they carry significant implications, so recognizing potential red flags is crucial. The type of dizziness can vary. It might be vertigo, unsteadiness, or a more vague sensation, often accompanied by other neurological symptoms. One of the most critical neurological emergencies that can cause sudden dizziness or vertigo is a stroke, particularly a stroke affecting the cerebellum or brainstem, which are areas of the brain crucial for balance and coordination. If dizziness comes on abruptly and is accompanied by other stroke symptoms like sudden numbness or weakness, especially on one side of the body, confusion, trouble speaking or understanding, vision problems, or a severe headache, this is a medical emergency requiring immediate attention Think fast, face drooping, arm weakness, speech difficulty, time to call emergency services. Multiple sclerosis, MS, is a chronic autoimmune disease that affects the central nervous system, the brain and spinal cord. MS causes inflammation and damage to myelin, the protective sheath around nerve fibers. This damage can disrupt nerve signals throughout the body. If lesions occur in parts of the brain or spinal cord that control balance or process sensory information from the vestibular system, dizziness or vertigo can be a common and sometimes early symptom of MS. Other MS symptoms can include fatigue, vision problems, numbness or tingling, muscle weakness, and coordination difficulties. Brain tumors, whether benign or malignant, can also cause dizziness, especially if they are located in or near the cerebellum, brainstem, or the acoustic nerve, which connects the inner ear to the brain, like in the case of an acoustic neuroma. The dizziness might be progressive, worsening over time as the tumor grows and puts pressure on surrounding brain structures. It's often accompanied by other neurological signs, such as persistent headaches, especially those worse in the morning or that awaken you from sleep, seizures, personality changes, weakness, or specific focal neurological deficits depending on the tumor's location. Certain types of migraines, known as vestibular migraines, can cause recurrent episodes of vertigo or dizziness, even without the typical headache pain. These episodes can last from minutes to days and may be accompanied by nausea, vomiting, and sensitivity to light and sound. It's thought to be related to abnormal electrical activity in the brain affecting the vestibular pathways. This is a diagnosis of exclusion, meaning other causes of vertigo need to be ruled out first. Parkinson's disease, a progressive neurological disorder primarily affecting movement, can also lead to dizziness and unsteadiness, though often this is related to orthostatic hypertension, which is common in Parkinson's due to autonomic dysfunction or medication side effects rather than true vertigo. The characteristic motor symptoms of Parkinson's include tremor, rigidity, and slowness of movement, but non-motor symptoms like dizziness are also prevalent. If your dizziness is persistent, progressively worsening, or accompanied by any red flag, neurological symptoms such as sudden severe headache, weakness, numbness, difficulty speaking, vision changes, loss of coordination, seizures, or changes in consciousness, it is absolutely imperative to seek prompt medical evaluation. Neuroimaging, like an MRI or CT scan of the brain, along with a thorough neurological examination, may be necessary to investigate these possibilities. While these conditions are serious, early diagnosis and treatment can significantly impact outcomes. The key here is not to panic every time you feel a bit dizzy, as most dizziness isn't due to these severe conditions. However, it's about being aware of the patterns and accompanying symptoms that might suggest something more is going on. Your doctor is your best resource for navigating these concerns, performing the necessary evaluations, and getting you to a specialist like a neurologist if needed. Understanding the full spectrum of possibilities empowers you to take your symptoms seriously and advocate for your health. Wow, we've covered a lot of ground today, exploring 8 different avenues that could lead to that disorienting feeling of dizziness. From the relatively simple fixes for dehydration or low blood sugar to the complexities of inner ear disorders, medication side effects, anemia, anxiety, heart conditions, and the more serious neurological issues. My hope is that this detailed breakdown has given you a clearer understanding of just how varied the causes of dizziness can be, and why it's not a symptom to simply ignore, especially if it's persistent, severe, or accompanied by other concerning signs. The main takeaway should be that while dizziness is common, it's also complex. The specific character of your dizziness, whether it's spinning, vertigo, lightheadedness, unsteadiness, or a floaty feeling, along with any associated symptoms and your medical history, provides crucial clues for diagnosis. Remember, this video is for informational purposes and to empower your conversations with healthcare professionals, not to replace a direct medical consultation. If you are experiencing dizziness, especially if it's new, recurrent, or worrying you, please make an appointment to see your doctor. To help me and potentially others in our community, if you let me know what kind of dizziness you're feeling, spinning, fainting, wobbly, etc., I can recommend more targeted remedies, or perhaps focus future content on specific types of dizziness in even more detail. Drop your experiences and questions in the comments below. I always try to read through them. If you found this video helpful, please give it a thumbs up, subscribe for more health insights, and hit that notification bell so you don't miss out. Stay safe, stay informed, and here's to feeling steady and well.